we are there. Okay, perfect. Happy Tuesday, everyone.
Hello, everyone.
Welcome back to the Birth Talk Show. And this morning, Martha and I are here at IVF MD in Boca Raton with Dr. Scott Roseff.
Hi.
Thank you so much for making the time.
Thank you.
And for anyone who's joining us for the first time with this week's episode, it's episode 8 of the Birth Talk Show. I'm Paulina Splechta, on-call birth photographer and filmmaker. And
I'm Martha Lerner with zenmamalove. I am a doula and a photographer and postpartum supporter as well.
And we just wanted to mention about the Birth Talk Show for those of you who are new to the show. This show was really born out of our realization of the need of a lot of families in South Florida who don't have the resources that we've gotten the opportunity to really learn about over the last
3 or 4 years that we've been doing this.
Yeah, absolutely. And we really wanted to bring the awareness of these resources to the families in South Florida, and that's why we're here. And we are on our 8th episode, and today we will be talking about fertility with Dr. Roseff.
Great.
So without further ado, I'd really love for you to talk to our viewers and our moms and our families about your philosophy of fertility, how you approach it, and us personally, we are I feel very swept away by your approach because I feel it's very holistic in its existence.
Approach,
it's in its approach. So please do tell us about.
I do take a different approach to fertility. People come to me, I've been doing this for almost 30 years, and people come to me with a problem. The problem is either getting pregnant or holding a pregnancy or both. I saw a patient this morning who has been trying for 4.5 years. She has both difficulty getting pregnant, and anytime she did become pregnant, she's lost those pregnancies. She's had 5 losses. So I'm an expert in getting to the bottom of what the problem is or the problems are. When people go to a fertility doctor, they typically start treatments. Okay, you're having difficulty getting pregnant, let's do this and see if it works. Let's do that and see if it works. But what I do is I always take a half a step back and say, let's get to the bottom of what's going on so I can know what your problems are so we can address them head on. My primary objective with every patient I see is to find out the problems and see if I can fix them or overcome them so that I can have perhaps the man take this pill and the female do this and then go home and get pregnant. So I like to restore natural fertility, and in doing that, it's a very complex picture. It's not just sperm and egg making a pregnancy, it's psychological issues, it's sociological issues, it's lifestyle habits. It's so complex. The person is a compilation of everything going on in his or her life. It's not just sperm and egg and with blinders on. And so I need to look at stress. I need to look at food. I need to look at exercise. Too little exercise can have an impact. Too much exercise can have an impact on their success. I look at body fat. Most fertility experts are not measuring body fat. Too little body fat actually has a very negative effect on health and reproductive outcome. Too much body fat, which is usually more commonly the problem, can have a negative impact on outcome as well as health. So, and you know, the saying is, if we don't have our health, you have nothing if you don't have your health. And so many people come to me with health problems that haven't been addressed. Even when they go to their family doctors, the family doctors are not addressing these issues with telling the patients that you have a problem that needs to be addressed before you get pregnant. I do a lot of what's called preconception counseling, where I go through factors that can cause a baby to be sick or a baby to be born with health problems or increased risk of autism, for example. And these are things that I look at before people get pregnant, so that when they get pregnant, they're going to have the highest chance of getting pregnant, staying pregnant, having a healthy pregnancy, and a healthy baby. And that really takes a very broad approach, which is holistic, rather than just, okay, we're going to do this treatment, hopefully you'll be pregnant, and out the door, and goodbye, and good luck. I want healthy mom, healthy dad, healthy pregnancy, healthy baby, and there's a lot that goes into mental health, physical health, reproductive health, and all of that.
That's amazing.
So it's
That's
a
wonderful.
very
Yeah.
big picture. People come with problems, and it's a jigsaw puzzle, and my job is to put the little pieces of the puzzle together, and it takes a lot of work, and it takes some time. I understand the desire for people to be pregnant yesterday. I've been trying for X amount of time, and I want to be pregnant, and I want to be pregnant now, but you always have to take a step back, or at least a half a step back, and address the issues. One patient came to me from Russia having failed in vitro fertilization 7 times,
Oh my
and when she
goodness.
came to her consult, she said, I heard that you're the best, and I want to do IVF with you, and I want to do it now. And I said, that makes no sense. You failed 7 times? There are problems here, and I need to level that playing field before you do this again. So I did. It took 4 months to level her playing field, and then when we did IVF, she conceived twins and delivered twins
Oh
first
my
time.
goodness.
And the philosophy is to do this once, to do it right, and just make it work.
Yeah.
And boy,
And 4
did
months
we.
is nothing to wait in the
It
grand
was
scheme
4
of
months, but
things,
4
you
months
know.
in someone who's tried for years
course.
and
But-
years and years seems like
But
forever.
I love
Yeah.
what you said. The philosophy is to do this once
to
and
do
to
it
do
right,
it right.
and just make it work.
That's amazing.
And
Yes.
often it does.
Before I met you, I've never had any experience with doctors who work in this field. And I only have stories from friends and family members of trials and trials of IVF that had failed for years and years, and they just were getting to the point where they felt that they were never going to be able to have a baby unless they get an egg donor, a surrogate.
So many people come to me from other fertility practices having been told they need an egg donor. I saw a patient this morning who was told over the last 3 years she was at her current previous fertility practice that she needs a surrogate. She needs someone else to carry the pregnancy. She doesn't. People who say that they were told they need an egg donor, I'll test them and find out that they really don't need to do that. And so you really need to know what's really truly going on, rather than say, well, this failed, that failed, so let's get a sperm donor or an egg donor and maybe that'll work. Let's get another uterus and put an embryo in there and see if it'll work.
Yeah.
You really need to find out what the problems are and address them. Sure, some people need an egg donor. Yes, there are occasions where someone needs a surrogate to carry a pregnancy, but so many people have been told the wrong thing, and then when I see them, tell them what they really need to do, first of all, they're blown away by it, and second of all, when they're successful, they say, I hear every minute of every day, I wish I came here first, rather than having spent X amount of time, X amount of years, X amount of money, X amount of emotional toil elsewhere. So I just like to see if I can help people conceive. First objective is natural conception. If that's not in the cards, if it's something that is not likely going to work, then there are tools that I have to assist people in becoming pregnant, but I want to look for the simplest, least invasive, least expensive thing that we can do to achieve a high degree of success. IVF is the bottom of the list. It's the last resort. It's the last thing that I ever want anyone to have to go through. Yeah, a lot of people need IVF, do IVF here, and are successful, but it's the last thing that I want anyone to have to go through.
That's amazing.
Amazing.
Yeah, I'm very.
Before we go on to the next question, I wanted to ask you, if you wouldn't mind sharing with us, what got you into this field? What made you decide to get into fertility?
You got a few minutes?
I do. I have to ask because that's something that I think is important to the people who are out there. Like, what is it that...
When I was in my training, I had to rotate through different disciplines in the medical field. So we had to do some time in pediatrics and general surgery and obstetrics and gynecology and psychiatry and all the different disciplines. And when I did OBGYN, and the first time that I was in a delivery room with someone and it was just me, they threw me in and said, go deliver the baby, and 1 minute it was the patient in the room with me, and the next minute there were 3 of us in the room, the baby was there, and no one came through the door. I said, this is the most miraculous thing I can ever fathom, bringing another life into the world. And I said, I want to be an OBGYN. I want to deliver babies and take care of pregnant women for the rest of my life. So then I started my training in just obstetrics and gynecology. And in doing so, one of the rotations that we have to do is we have to go through the infertility rotation. And then when I saw the heartbreak of people who were having difficulty getting to the point of that miracle, I said, this is what I really need to do. I need to help people to achieve that miracle. Rather than just bring the miracle and deliver the baby, let's help people who can't get there to get there. And so I went into the fertility field.
That's beautiful.
Wow.
Thank you.
That's awesome.
Yeah,
I
pleasure.
love it.
A lot of passion behind
No, yeah,
Yeah.
I like that.
the field.
So, what if a woman comes to you and is having difficulty conceiving? What's generally, because I know there's probably a million different scenarios, what's generally something that you would recommend for her to do at the beginning? First thing.
She, and if she has a partner, she and her partner need to look at their lives. They need to look at a broader picture of why they may either not be getting pregnant or may be losing pregnancies. Look at your lifestyle. Look at things that you're doing. Look at your nutrition. Look at your general overall health. If you're not healthy, you know, pregnancy is growing another life inside of your body for 3/4 of a year. And when I do the first pregnancy ultrasound and I measure the baby, and the baby is 5 millimeters on that first ultrasound, which is the size of your pinky nail, and there's a little flicker of a heartbeat, and you have this 5 millimeter fetus inside of you, and you have to nourish it, and you have to grow it, and you have to sustain it. If you're not in good mental health and good physical health, how do you expect your body to nourish and grow successfully another life for 3/4 of a year? So people really need to look at this bigger picture. Are we stressed out? Because there is a connection between the mind and the body. Are we doing, I had another patient this morning who was drinking 20 glasses of alcohol a week. And I'm not here to point fingers or say, you know, that's an excessive amount of alcohol, but, you know, 20 glasses of alcoholic beverage a week has been definitely shown to lower the fertility potential. And so you really need to look at, you know, what are you doing that might be impacting your fertility? Do you smoke cigarettes? You know, and that's bad for your health, and it's bad for fertility. A lot of people now are smoking pot, and again, not to be judgmental at all about it, but smoking anything can have a negative impact on fertility. And so you have to really look at, am I doing something that it may be having a negative impact on the likelihood of getting pregnant and holding the pregnancy? So you have to look at lifestyle factors. Are you overweight? Are you obese? Are you underweight? Because those can have effects as well. Men, it can be exposed to high levels of heat. Are you going to a sauna? Are you going to a jacuzzi or a hot tub several times a week? It has a really bad effect on sperm. So you have to look at certain things that can have an effect on fertility. And then if you're having difficulty and think there could be a problem, don't wait too long. Men make new sperm in their bodies, brand new sperm, every 10 weeks until they're dead. But women don't make new eggs. So when a woman is 25 years old, her eggs have been in her body for 25 years. But if she's 30 or 35 or 40, her eggs have been sitting on a shelf for 40 years. And since she doesn't make new ones, her egg quantity goes down. But more importantly, her egg quality goes down. And if the egg quality is low, then the egg may not fertilize. Or if the egg does fertilize and it's a bad egg, those pregnancies are more likely to miscarry. And if it's a bad egg or an older egg and the pregnancy doesn't miscarry, it's your greater chance of a genetically abnormal baby, like a Down syndrome pregnancy. So I think one of the important things for women to remember is that they should not wait too long. I ask my patients when they think their egg quality really starts to go down, and 90% of the time they say age 35, and that's not correct. The egg quality starts to go down around age 24, and it's a but it's a slow drop from 24 to 30, and then it's a pretty quick drop from 30 to 35, and it's a very sharp drop thereafter. So don't wait too long.
Okay.
I see people who are 40 years old who go to their doctor, their family doctor, or their healthcare provider and say, we want to have a baby, and the doctor says, well, you need to try for a year, and if you're not pregnant, then we can do some tests. And if you're 40, you don't wait a year.
No.
Yeah,
And if you're 35, you don't wait a year.
Okay.
So don't wait too long.
So I guess it really depends on the state of a person's health and their age, when they should start taking it to the next step. But I guess if we could generalize, if a woman has been having issues conceiving for maybe 3, 4, 5 months, what should her next step be at that point? Is that too much time to wait, or?
Well, no, unless there's something in her history or her partner's history that suggests that we're going to have a problem right from the outset. For example, there are women who don't get regular periods. You're 25 years old, you want to be pregnant, you get a period 8 weeks apart, 12 weeks apart, 6 months apart. Don't wait, there's a problem.
Okay.
Immediately, there's a problem. Go to your doctor and start to get tested and find out what the problem is.
That's good to know. Okay.
There's an infection called chlamydia. It's an infectious disease that can cause damage to a fallopian tube. If you've had chlamydia when you were 17 years old, and now you're 22 years old and you want to have a baby, get tested and make sure you don't have fallopian tube damage, you know, because it's in your history, and therefore you don't wait and wait and wait, because there's a predisposing factor that may be something right off the bat that can be addressed or should be addressed or looked at. So it really depends. You know, if you're under, in general, if you're under 35 years old and there's really nothing in your history that you think suggests you'll have a fertility problem, you could try for up to a year. If psychologically that's going to hurt you, then don't wait the year. Try see an expert, fertility expert sooner. If you've reached or passed your 35th birthday, the general rule is 6 months. If there's really nothing in your history, you could try for 6 months, and then if you're not pregnant after 6 months, see a fertility doctor.
Okay. Good to know. These are really great pointers. By the way, if anyone has any questions for Dr. Roseff, please leave them below and we'll definitely address them. I'm really curious of knowing, I know that you mentioned already so many different approaches towards infertility and fertility, but generally speaking, most people I've heard mention that the main fertility method is IVF. What types of fertility treatments do you offer here?
Well, like I said before, the first thing that I want to do with any patient is to try to see if I can address issues or problems to the point of allowing them to go home and have sexual relations and conceive on their own, and that's my primary objective with every patient I see. Sometimes if a patient comes here and had her tubes tied, she had 2 babies and now wants baby number 3, and she had a tubal sterilization, she's not going to conceive on her own. It's not in the cards. So depending on what the tests show, then the fertility treatments are dictated by the test results. For example, if the sperm is a little bit poor and all other things are okay, then there's a relatively simple procedure called Intrauterine Insemination, or IUI for short, that may be appropriate. But if she's 39 years old, the odds of success with that will be quite low. So we really need to look at the whole picture and say, you know, if you're 29 years old and we have a little bit of a sperm issue and you don't ovulate regularly, then I can give a fertility pill and we can do intrauterine insemination with the sperm to have a pretty good chance of success. If you're past your 35th birthday, and especially past your 37th birthday, then IUI is really not a great option. Fertility pills are really not very effective if you're older. So if IUI is not an option or a good option, then the next step above that is injectable fertility drugs that are given with the purpose of stimulating multiple eggs to grow and develop, but it would be dangerous to allow 6 eggs to ovulate and inseminate someone, because if we throw a handful of sperm at 6 eggs, she could possibly be pregnant with 6 babies, and that's not a good outcome. So if we're using injectable fertility drugs, then the treatment would be to extract the eggs, the multiple eggs, fertilize them and grow embryos, and that's in vitro fertilization. If we're doing in vitro fertilization, we have to look at the age of the female, because if she's past her 35th birthday, a fairly large percentage of the embryos would be typically chromosomally, genetically not normal. So rather than grow the embryos and put one into the uterus, we would genetically test the embryos for genetic mistakes like Down syndrome before we put an embryo into a uterus. Gotcha. And then when we have a genetically normal, good quality embryo, that would be the one that would be chosen to put into the uterus. So it has to be individualized and personalized for every patient, every couple. Mm-hmm. And one of the other things that I see from the records I get from people who have been to other facilities is that those facilities tend often to do cookbook medicine, as I call it. It's a recipe, it's a cookbook, and you get it, and you get it, and you get it, and you get it, mm-hmm. but she's different than she is, and she is, and she is, and you can't turn to page 6 in the cookbook and do the same thing for everybody. It has to be individualized, and that takes thought, it takes thinking outside the box, it takes effort, and it takes very individualized, personalized care. And I think, if I was going through it, that's what I would want to have done, and that's what needs to be done and should be done.
In all kinds of medicine.
Oh yeah, absolutely.
Right.
Across the board.
There are adjunctive treatments that I recommend for all of my fertility challenged patients. I do recommend fertility acupuncture for my patients. There are acupuncturists all over South Florida, and many of them have special expertise in the fertility field. Mm-hmm. I know who they are. They're out there, and they know typically who I am. And I tell every fertility patient I see that they should consider fertility acupuncture. There are many potential benefits of acupuncture. There's one particular acupuncturist who's now collaborating with me, and she's in Maryland. She's a fertility acupuncture expert, and the way the way that Radha describes it is one of the things she does with her patients with acupuncture is she looks at the patient's body as the soil, and she needs to prepare the soil so that when the seed is planted, the seed is going to germinate and grow into this beautiful life. If the soil is not in good condition, you can put the most perfect seed into the soil, and it's not going to end up as another beautiful life. So the acupuncture physician has great potential benefit to assist my patients in their fertility journey. I look at this as a team effort. I cannot do this without the assistance of other people like acupuncture doctors. I have fertility psychologists that I refer my patients to for stress reduction and mind-body balancing, along with the acupuncture. And there are psychologists everywhere, but some of them, and not a lot of them, have a specialty of reproductive medicine psychology, mm-hmm. and I know who they are, and they know who I am, and we collaborate together, and it really helps the stress reduction and these other techniques for achieving greater success.
That's excellent.
That's wonderful.
Yes.
That was my next question. What was going to be, what other alternative or complementary modalities would you recommend?
We have a tremendous demand for nutrition counseling and lifestyle changes in our patients. Many of our patients are overweight. Many of our patients are obese, and some of my patients are severely underweight. And they teach us nutrition about one day in medical school, so we can't be the nutrition experts, but there are nutrition experts out there. And in my practice, we have someone who has advanced degrees in nutrition and in exercise physiology.
Awesome.
She's a professor of nutrition at one of the universities in Miami, and I have my patients see her and work with her to optimize their health and optimize their bodies so that they will have a significantly improved chance of success.
That's
The
good.
patient who came to me from Russia with 7 failed IVF cycles had some physical body issues that needed to be addressed, lifestyle changes, nutrition and exercise, and eating right and eating better and losing body fat. And she worked with our expert. Her name is Marta. Hi, Marta. And over those 4 months, and then Marta said, time to go back to Dr. Roseff and start moving forward. We did with incredible success. So it's like I said, I can't do this alone. I have great expertise in what I do, knowledge, but it's a broader picture. It's a bigger picture.
I love it.
Has to be.
I am so excited by the fact that you're here. You're in the heart of South Florida in Boca, and so all the families from Port St.
All the
Lucie,
way
Jupiter
down.
can come, and all the families from Miami. So thank you so much for making the time to sit with us and talk to our
My
viewers.
pleasure.
We hope that we can reach at least one family that could benefit from this gentle approach to fertility.
I love it.
So thank you very
Thank
much
you.
again.
Thanks for having me.
Thank you.
And if
you for
anyone
being
has
here.
any questions for Dr. Roseff, please leave them below or send us a private message and we'll be happy to connect you.
Absolutely.
Thank you.
Thanks for watching, everyone. See you next time.
Bye-bye.